Welcome to video lecture number 3 for chapter 9, the nervous system. In this video lecture, we are going to discuss disorders of the meninges, disorders of the myelin sheath of neurons, and traumatic brain injuries. But before we go into disorders of the meninges, we should quickly review what the meninges is, in case you didn't read that portion of the textbook. So the brain and spinal cord that make up your central nervous system are cushioned and provided nutrients by something called the cerebrospinal fluid, or CSF. The meninges covers the CSF kind of like a layer of skin in order to kind of keep it next to your brain and spinal cord and to prevent it from spilling elsewhere. Okay, so this is kind of like the outer skin layer of your central nervous system. And we are going to cover two different disorders of the meninges. So the first disorder of the meninges is meningitis. This is one of the words on your word list, and it might sound familiar to you. So if we look at this word, we know that the suffix itis means inflammation, and you can probably guess what the root meninge means. So meningitis is inflammation of the meninges. The most common form of meningitis is viral meningitis, which can impact individuals of all ages. The other form is bacterial meningitis, which is more common in the very young and the very old. This form of meningitis, the bacterial form, is contagious via droplets that are produced when someone with the bacterial meningitis sneezes or coughs, so it can be spread really quickly in really close living conditions, like at college. So because of this, before you go to college, you are highly encouraged by your physician to get a meningitis vaccine. The prime time to get the vaccine for meningitis is around the age of 16, but I think I got it my senior year before college, I think, but you should get it at the age of 16 to help build your immune system for a few years before potentially being exposed to the disease. The symptoms for meningitis include fever, vomiting, a headache, sleepiness. A lot of the times you get this rash, like the one pictured, confusion. You usually have some sort of like a dislike for bright lights, like you can't handle them, and sometimes individuals can get seizures. The second disorder of the meninges that we are going to talk about is meningioma. The suffix oma means a mass or tumor, so you can probably guess that meningioma is a tumor of in the meninges. So these tumors usually are benign, meaning they are non-cancerous, they don't spread, and they're usually really slow growing and very spherical tumors. So this image here is a picture of someone's brain. That big white blob there is going to be a tumor of the meninges. Symptoms often take years to develop, and basically to cure all the symptoms, you just get it surgically removed because, again, it's not cancerous, but that usually takes care of it. The next set of disorders we are going to discuss in this video is disorders of the myelin sheath. Remember that the myelin sheath is the fatty substance that covers the axons of neurons or nerve cells to help the electrical signal or the electrical impulse flowing through a neuron to be efficient and very quick. So the first disorder we are going to talk about is demyelination. And if we break this word down, the prefix de means away from or without. The suffix ation means process. So demyelination is the process of losing the myelin sheath of a neuron. So the myelin sheath, these are all going to be disorders where the myelin sheath is breaking down. Once the myelin sheath breaks down, it exposes the axon underneath, whose job it is to transmit impulses to other neurons, and damage to the axon is highly possible, which when that happens, it breaks the neuron, killing it and killing its ability to transmit impulses, which is obviously very dangerous because then our neurons, the connections are lost, causes us confusion, memory loss, all of that stuff. So this demyelination can be caused by inflammation in the body due to other diseases, a vitamin B12 deficiency, certain poisons in the system, and some medications. The next disorder of the myelin sheath is Guillain-Barre Syndrome. This is a disorder in which the body actually produces antibodies against the myelin sheath of its own neurons. This disorder leads to demyelination and causes a loss of nerve conduction, muscle weakness, and paresthesia, which is one of your words. So if we break down paresthesia, the suffix ia means a condition, the prefix para means abnormal, and the root esthis means sensation or feeling. So if we put those word parts together, paresthesia means abnormal sensation, such as if you have like abnormal tingling, like an abnormal burning sensation or prickling. So because of the demyelination with the syndrome, it causes kind of those abnormal sensations. Multiple sclerosis, also known as MS, which is one of your abbreviations, is another disorder of the myelin sheath. Multiple sclerosis is caused by, again, the demyelination of nerve fibers in the brain, in the spinal cord, and in the optic nerves. MS is a progressive disorder, meaning that it comes on gradually over time, and the symptoms often include muscle weakness, pain, numbness, and vision loss. And remember that demyelination causes the myelin sheath on neurons to break down, and it can lead to scarring, which hardens the sheath. So that's where the term sclerosis comes in, because the root sclero means hard, and multiple, obviously it affects multiple groups of nerves because it affects the brain, the spinal cord, and your optic nerves, which are the nerves in your eyes. So when the neurons in the body begin to stop functioning correctly, obviously then the body is going to stop working correctly as well. So during this disease, different nerve fibers are affected at different times. So when the symptoms worsen, we call that exacerbations. And then when the symptoms show partial or complete reduction, that's called remissions. So usually MS patients have periods where their symptoms are absolutely terrible, but then they have periods where the symptoms seem to either go away or at least calm down. So where the symptoms worsen, that's exacerbations, and where the symptoms go into remissions, that is called, or where the symptoms go away basically is called remissions. MS has an average onset between the ages of 18 and 35 years old, which freaks me out. It is more common in women than men, but the cause is unknown, and there's no cure for it. But there has been some recent research that has found some options to not cure the disease, but to slow the progression of it. So there's some promise in that. The last disorder we are going to talk about for disorders of the myelin sheath is going to be post-infectious encephalomyelitis. Encephalomyelitis is one of your words, and it looks super scary, but if we break it down, it's not too bad. So the root encephalo means the brain, and the root myel means spinal cord. We know the suffix itis means inflammation, so encephalomyelitis is inflammation of the brain and the spinal cord. So it's basically inflammation of your entire central nervous system. The term post-infectious, which you can probably guess means after an infection. So post-infectious encephalomyelitis is inflammation of the brain and spinal cord after a viral infection or a vaccine. Because remember, a vaccination or a vaccine is basically introducing like a kind of dormant form of a virus into your body to create that the immunity towards that virus. This is a very rare autoimmune disease that causes demyelination when it's triggered. So again, either by a viral infection or a vaccine. This usually happens in younger children around the ages of 5 to 8, but older adults can get this as well. The symptoms usually resemble those of multiple sclerosis or MS, with the only difference that this only flares up once, whereas MS flares up multiple times. Symptoms of post-infectious encephalomyelitis include a rapid fever, loss of consciousness, coma, and sometimes death. This disease affects about 8 in every 1 million people per year, and full recovery is between 50 to 75%. The average time of recovery is usually between 1 to 6 months. Traumatic brain injuries, or TBI, is our next area of focus, and TBI is one of your abbreviations. TBIs, or traumatic brain injuries, are caused by contusions, which is one of your terms and means the bruising of a tissue or organ. In this case, we're talking about the bruising of your brain. Contusions of the brain are caused by a back and forth movement that causes the brain to come into harsh contact with your skull. So let's say that someone is driving in a car going about 55 miles an hour and are hit head-on by another car. Their body, if you know Newton's laws of motion, is going from 55 miles an hour to 0. That immediate stop is going to cause that person's body to try to continue moving forward at 55 miles an hour. So their head is going to slam forward, because usually their body is going to be stuck behind the wheel. So their head will slam forward, and as it tries to continue in motion, their brain is going to be propelled forward, squishing itself against the front of the skull. This is called a coup. C-O-U-P is pronounced coup, and that is one of your terms. The head then is going to rebound backwards, causing the brain to be propelled backward in the skull, squishing itself against the back of the skull, and this is called a contre-coup. So a coup is the brain being propelled forward and squishing against the front of the skull, so you can think of it as damage to the brain due to the front of the brain hitting the skull, and contre-coup is the opposite, well, kind of the same thing, but in the back of the skull. So both a coup and a contre-coup are going to cause contusions or bruising of the brain, which leads to traumatic brain injuries. Like concussions would be an example of a TBI. If these contusions are bad enough, they can cause blood vessels in the brain to burst. They can cause a part of the brain tissue to be split. It can cause neural connections to be cut, and it can also lead to swelling of the brain, which can eventually lead to parts of the brain ceasing to work altogether. So again, contusion is the bruising of a tissue or organ. In this case, we are talking about bruising of the brain. A coup is going to be damage to the brain in the by hitting the front of the skull, and a contre-coup is going to be damage to the brain as it hits the back of the skull. The last traumatic brain injury we are going to discuss in this video is shaken baby syndrome, which is abbreviated SBS, and that is one of your abbreviations. Shaken baby syndrome is exactly what it sounds like. It is brain damage that is a direct result of a baby being very violently shaken. SBS usually occurs in children under the age of 2 because their neck muscles are weak and their head is very heavy for their body size. So that leads to a high range of motion when they're being shaken, and it leads to a lot of momentum in their head swinging again while being shaken. So besides brain damage, children with shaken baby syndrome can experience hemorrhaging in the brain, which is bleeding profusely. They can experience damage to their spinal cord in some cases, and it can also lead to fractures in the ribs and limb bones, because if you think about how violently you'd have to shake a baby, you really have to grasp them around the ribs. The violent shaking obviously can also result in the death of a child, but the symptoms usually begin to appear immediately after shaking and peak within 4 to 6 hours after the incident if the baby does not die. SBS can also lead to severe neurological deficits, so it can lead to CP, it can lead to paralysis, it can lead to vision loss or blindness, it can lead to mental retardation, and it can even cause epilepsy. And the National Center of Shaken Baby Syndrome estimates that there are between 600 and 1,400 cases in the US of shaken baby syndrome each year. And that is really only because they look at the deaths of babies with SBS, and they can look at these kind of severe neurological deficits that are going to be that are caused by SBS, but there are a lot of babies who probably people don't know that they've been shaken because they just don't show severe enough signs of it. And unfortunately, on that downer of a note, that is it for video lecture number 3.